Okay, I'm gonna rant about food allergy testing. Whenever I go on this app, there's several pseudo doctors, pseudo health practitioners that are talking about, oh, I did a food allergy test for this, or you need a food sensitivity test for that. At home food sensitivity testing. On any given day in my office, somebody comes out with an outside allergy test for food, like 3 or 4 times a day, and they want me to interpret it for them, and it has like 700 foods that they were tested for that don't even make any sense. I had a test once say that a person was allergic to boiled milk, but not raw milk, which just makes no physical sense. I have gone through medical school, I have gone through internal medicine training, I have seen pediatric training, and I've gone through allergy training, and I can tell you of all the doctors that exist, there's only 2 types of doctors that really have any familiarity with food allergies and their manifestations. And those are board-certified allergists and pediatricians and pediatric gastroenterologists. It's common for pediatricians to see issues with formula feeding, with cow's milk protein, and gastroenterologists to see eosinophilic esophagitis, where they have to look at food allergies and elimination diets to help treat that. And as allergists, we deal with the whole gamut of food allergies, everything from non-IgE mediated food allergies to anaphylactic food allergies to food allergies that could be exacerbating eczema and the like. But because food allergies are very commonly misunderstood, and because the symptoms can be so widespread with the manifestation of a food allergy, a lot of people try to sell these fake food sensitivity tests in order to tell a person that their symptoms are coming from a specific food, even if the test makes no sense whatsoever because they don't know how to interpret the test. You don't check for food allergies to see if you're getting acne from food. You don't check for food allergies to see if it's causing weight gain. You don't check for food allergies to see if it's causing behavioral issues. And you don't check for food allergies if you can see if it can lower your cholesterol. Foods have multiple effects in our body. They can affect our metabolism. They can affect our microbiome. But when you do a food allergy test, you're specifically saying, how is my immune system interacting with the food? And it might be interacting in a tolerant manner, and the food test can be confusing in that sense. It could be cross-reacting with a pollen and then activating the food allergen on the test, or it could not be reacting at all, and the test is just an incidental finding. There's a saying in medicine that he who orders a test must know how to interpret it. If the doctor doesn't know the difference between overalbumin and overmucoid in an egg, or an S2 albumin versus a PR10 protein in a peanut, then they should not be doing a food allergy test on you. If you think a food allergy is causing the problem, just go to a specialist and get the test done there. Don't do an online test, and don't listen to some random people who say, I threw away all these tests and I got people off all these meds by doing these food sensitivity testing. They are just trying to take your money. Hope that helps.